Respiratory acidosis and alkalosis. Respiratory involves the lungs. Acidosis and alkalosis refer to the pH. Normal pH is 7.35 to 7.45. Anything lower than 7.35 is acidosis. Anything greater than 7.45 is alkalosis. Now, remember, we breathe in oxygen and we breathe out carbon dioxide. So when a patient has a diagnosis that affects their breathing, it can lead to acidosis or alkalosis. So let's call carbon dioxide our acid. If the diagnosis causes the patient to retain too much carbon dioxide, it can lead to respiratory acidosis. And some of the things that can cause that can be like medications that cause respiratory depression. And so on the ABG, the lab work will usually show a low pH due to acidosis and a high PCO2 due to retaining too much carbon dioxide. If the diagnosis causes the patient to breathe out too much carbon dioxide, this will cause respiratory alkalosis. And something that can cause that is like hyperventilation. So on the ABG, the lab will show you a high pH greater than 7.45 due to alkalosis and a low PCO2 less than 35 because the patient is breathing out too much carbon dioxide. So what's your role as the nurse? Monitor the ABGs, monitor for signs and symptoms of acidosis, monitor for signs and symptoms of alkalosis, and also remember the acronym ROME, meaning respiratory opposites. So the pH and the PCO.